Feeling prepared in a moment of crisis is not accidental. It is the result of consistent training, clear communication, and intentional planning. Yet, many employees still report that they do not feel fully ready to respond to emergencies in the workplace. That gap creates real risk. When uncertainty exists, response time slows, decision-making suffers, and the potential for harm increases. This is where HR has an opportunity to lead by strengthening preparedness efforts, reinforcing expectations, and ensuring employees know exactly what to do. Organizations can shift from reactive responses to confident, coordinated action. Workplace hazards exist in many forms. Equipment, materials, and even routine tasks can introduce risk if not properly managed. Protecting employees requires more than providing safety equipment. It involves ensuring that employees understand how and when to use it and why it matters. Strong safety protocols combined with ongoing training help create consistency. When employees know what is expected and feel confident in their actions, the likelihood of incidents decreases significantly. Training is one of the most powerful tools organizations have to prevent workplace injuries. Effective training goes beyond checking a box. It builds awareness, reinforces safe behaviors, and helps employees recognize risks before they become problems. Whether it is operating equipment safely or maintaining proper posture at a workstation, these small, consistent practices add up. Over time, they create a safer and more resilient workforce. A safe workplace begins with the environment itself. Facilities must be designed and maintained to support employee safety, from proper ventilation systems to reliable fire protection measures like alarms and sprinklers. Regular inspections are critical. They help identify potential issues before they escalate and ensure that the physical workspace continues to meet safety standards. A well-maintained environment sends a clear message: safety is a priority. When an emergency occurs, preparation makes all the difference. The Occupational Safety and Health Administration emphasizes the importance of having a well-defined emergency action plan. But having a plan is only the first step. Employees must understand it, practice it, and feel confident in executing it under pressure. Clear procedures, well-communicated expectations, and regular drills help ensure that when a real situation arises, the response is immediate and effective. Workplace safety is closely tied to overall employee well-being. When employees are struggling, whether with mental health challenges or substance use, it can impact not only their own safety, but also the safety of those around them. Organizations must take a balanced approach, offering support through resources and programs while also maintaining clear expectations. Creating an environment where employees feel supported encourages early intervention and reduces long-term risk. Employee health is not just a personal issue, it directly impacts organizational performance. According to the Centers for Disease Control and Prevention, indirect costs like absenteeism and reduced productivity can far exceed direct healthcare expenses. When employees are not well, the effects show up in missed work, lower output, and decreased engagement. Investing in health and safety is not just the right thing to do, it is also a strategic business decision. Many workplace injuries develop gradually over time, often going unnoticed until they become more serious. Repetitive motion injuries, like carpal tunnel syndrome, are common in office environments, while lower back injuries can result from improper lifting or prolonged sitting. Organizations can make a meaningful impact by focusing on ergonomics, providing the right equipment, educating employees, and encouraging healthy work habits that reduce strain. Substance abuse and workplace stress present significant challenges that can affect both safety and performance. Employees experiencing high stress may show signs of burnout, disengagement, or reduced focus, all of which increase risk. Organizations can respond by offering employee assistance programs, wellness initiatives, and training that supports stress management and resilience. These efforts help create a more stable and supportive work environment. Workplace violence is a complex issue that requires careful attention and planning. Risk factors vary by industry, but may include frequent interaction with the public, handling money, or working in high-pressure environments. Effective prevention programs focus on clear procedures, consistent documentation, and open communication. When employees feel comfortable reporting concerns and leadership responds proactively, the organization is better equipped to prevent incidents. While managing health and safety, organizations must also protect employee privacy. The Health Insurance Portability and Accountability Act establishes strict guidelines for how health information is handled. This means that access to protected health information is limited and typically requires written authorization. HR must carefully balance the need to manage safety with the responsibility to protect confidentiality. Creating a safe workplace does not happen by chance. It requires intention, consistency, and ongoing commitment. Strong training programs, clear communication, and a focus on employee well-being all contribute to reducing risk and improving outcomes. HR plays a central role in bringing these elements together, helping to build a culture where safety is understood, practiced, and valued. When safety becomes part of the culture, organizations not only protect their employees, they position themselves for long-term success.